I'm Dr. Lou Rubino, and I am the program director and the lead for the MPA Health Administration Certificate Program. It's very historic times. I tell my students this, and it's like never before in my lifetime that we are experiencing such a really dynamic and important change that's happening in our country in regards to healthcare. It's very exciting, but it's also going to offer a lot of opportunities to students like yourself. We are looking at the Obamacare right now and seeing some of the results, whether you're getting your news on the internet or on TV, or if you're a dinosaur like myself and looking at the morning paper, you can't neglect seeing something about Obamacare. And it's a good thing for our country. It really is going to allow a lot more people to have insurance and the eligibility in order to get the health care that they and their families need. With Obamacare, it really is a paradigm shift for our nation, and it is a new reality. Affordable Care Act will provide a lot more necessity for jobs, for a lot more administrators and people that are working in order to provide people the coverage they need and to oversee the care that's being provided. So as we look at the U.S. healthcare delivery and this program that we're offering you, we see this as the availability of you to be able to get the information and the knowledge that you need in order to be successful in the healthcare field. It's something that is not just centered upon the United States, though. I do my research in China on healthcare reform, and it's very similar what they're trying to do than we're trying to do. And if you travel anywhere, you'll see that healthcare costs have gone up so much that the governments need to do something in order to try to provide more and better care to the people. So the globalization has provided this opportunity to look at healthcare and what we can do to improve our delivery system throughout the world. And this program will be also able to apply the principles that we see here at the United States, but also in other settings. So it's an exciting time with the globalization and what's happening in order to get you the information that you can obtain in our degree and certificate program and apply it in a variety of different places. We also are experiencing, as well as the rest of the world, an aging population. We baby boomers, are going to need more and more health care as we're aging. We're living longer because of the fact that we do have medicine and treatments and new innovative ways to keep us healthy. And this is going to offer us and more people to needing health care more employment. And so we are experiencing in the United States an increase in our aging population, but that also correlates with more healthcare work and applications. So the jobs are going to follow the aging population. Today, also, leadership positions, you really do need a graduate education. Even probably 10 years ago, it wasn't the same as it is today. It's a wonderful thing that more people have gotten bachelor's degrees, but I've been teaching here now for 15 years. I used to be a hospital administrator my prior 20 years to this, and I've seen many, many changes in our industry. Used to be that my students wanted to all be hospital administrators, but that's not the case now. Now we have lots more opportunities and lots more available sites that I'll talk about a little bit later as to where you could work. But this idea that leadership and what we need in understanding how to manage and supervise employees is essential for people to be able to climb up that ladder in their organizations. And these programs will allow you to do that. So it's a very exciting times for us, but also exciting times for all of you in order to look at your future and see if this is not only the program's a good fit for you, but also a career in health administration is a good place for you to go for your future. We're offering you a very unique program with the MPA, Masters in Public Administration, with the Health Administration Certificate. It's the best of both worlds. It doubles your opportunities. Because I have an MPA, it offers you the opportunity to learn about management and administration that could be applied really to any setting. The Health Administration Certificate that's linked to it gives you that special application for the healthcare industry, of course. The MPA, you might think, why public? And does that mean just a government job? And it doesn't mean that at all. The MPA degree, even though it's Master's in Public Administration, it really does apply to all settings in healthcare. This graduate certificate gives you the special application that you need, but the MPA gives you the structure of the administrative processes and theories. The program provides these managerial competencies for government and not-for-profit type of positions and places, but we end up in healthcare in the having to have the knowledge and skills of understanding the intergovernmental types of relationships, because whether we're a private hospital or a medical group or a nursing home or any other kind of healthcare type of business, we end up dealing with the government. That's a big payer for our patients. It's somebody that we will, under Obamacare, get even more involved with government. And so that's why this special Master's in Public Administration combination is so important. And it's really set for the future, which is now here in the United States. So it's very exciting times that you can not only learn the managerial competencies that come from the MPA, but then get the special application for healthcare and leadership and administrative positions. So here are some learning objectives, what you can do with your health administration focused MPA. Apply the advanced knowledge and skills for successful health administration practice. So it's the skills and knowledge that you need to go out there and do it. A lot of it is giving you confidence because you've learned these things in class, and then you apply it onto the job, and it'll give you what you need in order to be successful. You can lead contemporary public sector and healthcare industry units and organizations with this focused MPA. And you can apply the management and the healthcare administration theory to the professional practice of health administration. So it's a combination of the two that really provides you what you need to be successful. You'll engage in thoughtful and ethical professional practice as a leader in the healthcare industry, always very important. We believe our healthcare industry, attracts a special type of person, one who wants to help people. You don't have to be a clinician, you're still helping people by working in healthcare. And this idea that ethical treatment of people and patients, as well as applying to professionals, your employees, your doctors, it's a very big part of our program to make sure that you understand the professionalization and what's really important to be successful in our field. You engage in current and relevant policy creation and implementation through this program. So much new policy has been developed through Obamacare, but it's going to continue. It's not something that just happens once. Obamacare is being phased in over several years. And so you're going to see different policy changes, and you're going to be seeing some tweaking of policies depending on who gets elected next year, or the prospect of changes that could be occurring in the industry are still there. But we're going to give you the knowledge that you need in order to navigate through those waters no matter what's happening. Apply cooperative and collaborative practices across units and organizations. You can't work in a silo any longer. We in healthcare understand this. Teams are so very important, interdisciplinary teams. More than when I was in school or when I was practicing as a hospital administrator, all different types of people have to come together with different specialty in order to do what's best for the patient. And it provides the administrator and the administrators that we need this opportunity to collaborate, to bring groups together in order to have team building and to get the most out of these teams, that people can use the synergy that's created by working in groups in order to perform better, in order to increase your organizational abilities to be successful. So our program will allow you to understand how these types of cooperative and collaborative practices come into play, and what you can do as a healthcare leader in order to be supportive of that. And to manage today's diverse and expanding public sector and healthcare industry workforce. Those of us that are in Los Angeles know the diversity here, but we're just the beginning of the nation, increasing in diversity throughout the rest of the nation. as I said before, you know, through globalization, it's really the ability for us to work with all types of people. And our program will allow you this opportunity to explore how you can be more successful in dealing with a diverse workforce, but also a diverse patient population. Cultural competency is one of the skills that we will provide you in order to really make sure that you're doing what's best for the patient, depending on what their particular background is, so that you can you know, excel at what we're doing, be basically very patient focused and centered, so that depending on where they're coming from, their background, their heritage, their religious orientation, we're going to be seeking out the healthcare treatments and medicines and provision of support that's going to match what they need for their culture. So our program is not just for a setting in one particular area that might have a population that's very homogeneous. It's to expand out to a great number of different people of different types. And this program, I think, is a good program in order to allow us to give you those kind of tools and techniques to be successful. So the different types of settings and the different types of jobs that you might be able to apply for or to lead yourself into if you're already working at a place of employment. You might be looking for your personal development and professional growth. Administrators, program directors, program coordinators, project managers, senior directors, supervisors. These are all managerial types of jobs that are going to be there, that have to be there. We always need people supervising other people. So customer relations coordinator, division lead, office manager, because these titles are appropriate for lots of different healthcare sites. It's not just a hospital anymore, it's a lot of other different places. Next slide, please. Who took it? So we work in hospitals and public health agencies, in medical groups, clinics, and outpatient settings. That in particular is a big growth area right now. Lots of doctors types offices coming together with more of an interdisciplinary team, hiring people that are healthcare administrators, public health workers, in order to provide better care for their patients, more coordinated type of care. But lots of other offshoots to the diversification of our healthcare industry away from hospitals into other settings like surgical centers, imaging centers. These are all opportunities for people with the MPA and the Health Administration Certificate to work at. Home health agencies, hospices, these are part of the long-term care industry. With the growing senior population, there's going to be many, many jobs and many people that need supervision at these different types of sites. But health insurance companies, sometimes you don't think about that. You think about going to work for a place that is actually treating patients. Well, health administrators are at these other type of sites that don't necessarily have patients coming to them, but they do somehow are involved in the delivery of health care. So insurance companies will need the MPA with the Health Administration Certificate in order to have eligibility workers, provider relations representatives, people that are supervising, the people that are getting the contracts with the government, with the doctors, with the hospitals, many, many different types of jobs associated in the health insurance industry. And then all these government offices that are now dealing with Obamacare and getting the insurance exchanges, getting people onto getting them coverage that they need, even the government offices for Medicare eligibility, Medicaid eligibility. Those are healthcare administrators that work there and that supervise the workers also. So we want you to think about this as a opportunity to get a degree that you have a chance to work at many different types of sites that are involved in the healthcare delivery of the patient. So we think that the combination of the MPA to the with the Health Administration Certificate will open those doors for you. But if you're already working in the industry, we'll provide you that advancement that you might need, the recognition and the increased knowledge and skills that will help you in order to be promoted or to go to a different site or different placement at a higher level. So it's a exciting time for people in the industry but are not in the industry to come into our program and to get involved.